Journey and I pese omuchi Ghana man nyina kwachi.
Ompeso mutwinye kwachi.
Mutwinye kwachi.
Arentia.
Nya, sir, mefa akonyeso chief for
okay.
Minister for Health Honorable Kwaba Metakando. Chief for nyina. Now respectfully no, sir associations we know. Professional associations of psychiatric nurses. National Associations of Registered Midwives. Union of Professional Nurses and Midwives Ghana. Ghana Registered Nurses and Midwife Associations.
Associations are
4. Omunyina eka Ghana Registered Nurses and Midwife Association.
How?
So we are dealing with 5 groups. 5 associations.
Eti sa 4 yi.
Omunyina
kwa ejuma. Omunyina sa kwa from one group.
Omunyina kwa ejuma. They are not in support of the strike of the Ghana Registered Nurses and Midwife Associations. Omunyina.
The 4 associations here.
Omunyina kwa ejuma.
Omunyina kwa ejuma.
Omunyina kwa ejuma.
But they are also saying that as our membership no money because you have about I think I listened to a year or general secretary one me brother Bakudi in command pay.
Yeah.
Or say mukita nipa be 128,000 no. 5th group na all striking. Almost for me about 90,000 and 95,000 uti free manager say they have the members.
And who compare you are using your number now who won.
Yes.
And our person the intimidation sana. Or you are just going through the process. So no matter also. Let's just say nunti because say who no mess no. Who follow due process.
Okay, yes, you saying. Asem we do nkomo a atwe aba enne for the first time.
Yes.
Then I see about saying.
Next year is somewhere May 2024. And now yes conditions of service na bi ni ho.
Okay.
Ebi wo ho a omudi adwuma. Eno na ban hwe so de tua anansi ka.
Okay.
It's 2024 May and almost signing a new agreement. It was supposed to take effect in July 2024.
The same 2024.
The same 2024 now.
Okay.
Obi hu ne esi. And as ha anansi for ibia see the asem no kokod na emre omuye conditions of service no ya consult wo. Asem we could quarter from July to December. Ya to abani wie ya. And yes ya asem na work to ya ko ya ba nti ya shishi yentem. So the transfer of implementation only ya dia wetu abanya aba fofo is. It's about say ya be implementations. We share conditions of service. Appendix A ni nyina is in force. Say aban edi hu djuma etuaka.
Appendix A
no ni nyina has been already been absorbed. Appendix B. And nyama bi wo mu aban si no. Se ba se ye be implement this same way. Sa nyama na wo mu na. We may not be able to manage it properly. Now, the agenda of the government is to research. It's researching it. No, nyama best see a kwanya ayentimi enya ne wo se. Yeah. Let's sit down and dialogue.
Okay.
And so during the process now, dialogue, be pie nyama bebre so. We share Appendix B 6, Appendix B1, which is talking about allowances for doctors, nurse, and nurse for a doctor for mucha war. Most of the nursing training institutions.
Okay.
Research allowances. It stated clearly say the person must publish some research materials. Sa niema no eba wi a then akatua no beba on the government based rate. It is no na rate no na any ho.
Okay.
Over here Appendix B8 no. It's talking about rural areas. When the SLTs are rural areas, what technical measures are we putting in place? And here I can say, we are identifying this particular community as a rural area. And you share and share, and find share that you better know be about say, or to Kolibu Akranos your rural area. And so let's dialogue, let's look at it. Let's look at say, upon budget to say, okay, we'll do a rural area. Now we 1,000
and I say rural incentives.
Incentives. And so let's do the calculation. Now me who say me year calculations now say be 2,000 met me at here. Who see that be? So at the round table, Now they knew what they were doing. Now a bin him say, me we ya me too quite many ho. Okay, nipa to show when him na at the negotiation table no. And I want to assure nurses I will ATM ni say. One, mamu ma being used one future empire confed and compare on only future. Because the man be wo we still need to sit down near discussions near how good we'll be able to implement it.
Eti mo person ka mo review document no.
He said the document about say it has been approved.
Yes.
Abaya Jatum.
Yes.
And I mean maba. Udi bremi say I can implement it.
Yes.
Say who be here say ebe transit. Na me bisa say. Ebi na me bisa what is the category of rural areas?
Okay.
Facility be na rural areas. And na near we na any rural areas. Sa nyama we nyina ye transit ye kan we a then we move on. And then you see say dia ye fa call labor commission. You could do labor commission our 7 notice say from 2nd of June you are embarking on strike. 30th labor commission say Dabi. Don't go on the strike. Mumra ni nyina ye transit.
30th May.
30th May.
Okay.
Mumra ni nyina ye transit. Mwama.
Labor commission frame meeting.
Omanko. And the minister na kasa honorable Kwabementa Kando. Say I want Ghanaians to know say. Enye nsem nyina na wuti ni from amwa.
Okay.
The man is working. Sometimes he will sit down say oti ho no mu train say oni mu ba be meeting. But omu ba the post and crowd say we have some backing say we will not listen to you. Utimi hwe obi ene na de we anipa ne wo kasa no. Officer na aban adwuma na we ana say uni no ebusuan bi ho.
To check the body language.
The body language no kana odi aba meeting as no kwara say.
Bibia ne wo kra kan be.
You have 5 negotiation bodies are muti wani. The 4 of them are okay. Na ba kon de. Etu hwe o declare strike na no ni Ghana. And I want him say who declare strike ni we are. Negotiations may not be able to continue again.
I know there.
Until what declare na wo ni ho no. Ehim fa ne ye be gina de aka asem. Ehim fa pa ne ye be gina de aka asem. Until a number of interventions every labor commission fair wages and salary commission every nyina be transit last Monday you know see. Let us call off the strike. Now, me labor national fair wages and salary commission make proposals.
Okay.
But before send me proposals no beba. Let's call off the strike so we can sit down together and negotiate. They said no. And you know, yeah, teacher said. Rotation nurses for honuma abaichu amuka amuko edwuma no. Some of these nurses will even go and lock the facilities amu prema amunko enkoko edwuma.
Self facility ni abandia.
Abandia. Eti who call striker? Facility no so eyudia. So it's just a matter of inviting the general public to impound on government say government anye na edwuma yi. But I want to assure you the leadership of the Ministry of Health is committed to negotiations.
Eti enya in a situation be say the minister in charge and one sense say BBC basi na o play like
omu name
towards engagement and ama be say aba
fine ono wo ho
okay
oko Geneva ni be obaye
okay
he ran from Geneva to Ghana na mo amukọ emu if you want us to negotiate now what are they? We had a negotiation table. We sat that on Monday. Our ministry hall, Fair Wages and Salary Commission hall, Ministry of Finance by leadership. By any say they are not going to after the meeting. They are not going to consult the leadership. And so if you have a whole commissioner sitting down, no about better hall. Now one ma nani pa usmani ba no so onye ready to onye capable of taking decisions. Then what are you trying to say?
Boss, anyone was man.
Exactly. Now, when you look at the caliber of people, I bet now on Ukraine, they will say, some equal respect say these people. I mean, you mukwakwashi idea. They are. They will say, me find it be more.
When you listen to them, one must say there is nothing there to negotiate because already no negotiation. You implementation stage and your me too.
Say, but you know the political background is every year. I mean, me mu hwe na ewu. na da achi bi obi besu ba kwa gyina ba bi say obi aye commitment to some crimes and na say because omu nim ne ewom omu na nim ne ewom
o de oni ma fe no aba
afa na maba na me si ne na ewom na wo pese me nya implementation in the first place.
Yes.
Fabra na me hwem ye entrance na me hwe ne ewom. So now bisa how say how many rural communities, rural hospitals do we have? Facilities been declared by say we a rural
almost description and government description now because
exactly.
This facility falls under rural community.
So you are able to produce the agreement, the scheme of service agreement.
Okay.
Where is the description? I just a facility way, a rural facility. Now, mumu when I publication be a buying was say so these are the things we need to dialogue. Ni ahwe say okay, this and this and this we ye betimi aye we ye ntimi nye. We ye betimi aye we ye ntimi nye. Why hwe na say we wie na say enya nurse for corner Ministry of Health every so. Allied health, pharmacists, laboratory technicians, medical doctors, so everybody is waiting. So we call we are we be hwe na we so di aba. Na ban betimi atia.
Fidie no we say na
aban betimi atia na. So I expect say a bit appreciate nyana one year in as we work towards progression. Say okay, going forward. Now commission and by and see we want to start implementation from 2026. So that we can factor that in the budget. We see that. So they are not ready. Just say, when you're ready, say they will go into negotiations. Some we are ready, some back on negotiations, and they wouldn't have embarked on the strike in the first place.
One of their claims to be said as far back as January, and I was starting our money ministry in Hong Kong, and the minister and the finance minister, my assurance is say, I'm not sure no one can want them. But unfortunately, I'm already budget for from second quarter to the year December. That proposal or that, if anything, agreement with the then government, it wasn't captured.
Sir, the first quarter budget was prepared by
the former government.
And according to them, the issue was resolved in December.
Yes.
So how come that was not added to it? Say, yeah, I was here by Jintuma.
Yeah.
The first quarter budget by around December.
Yeah.
And see, the outgoing government now said there are problems with it. The outgoing government now said there are problems with it.
I know G2.
Okay, G2 we no. I didn't the first quarter implementation. I was some
they count.
It is obi e sheche no wabo kutupan say go and do this. Mukokoye way, munya way. Some of the things that we need to be very careful. Say that actually ehu akonta wo ho ye bebu. Say am wan Jeremiah ye bebu achenye kopon. So we urge all the nurses say some of their leadership are fighting their own interests, and it is not a conditions of service now money buyer. Some category of nurses are out. They affected the general nurses no too uniform. And no affect you omunyina. But most of the implementations I work appendix B no is even repeated in appendix A. And then no just say aban e di kan ye ho adwuma dada. So we would still need them at the table. Aban here on the table. We appreciate their effort. Unless for yenim say omuka adwuma no mani ye. But we should also give respect due to other professions. Together, we can develop the health sector of this country. Then yes, because you have the majority, who you saw majority no they intimidate obi. Because these are also another associations. And they are ready to work, and they are at work. They are ready to go to the negotiation table. And now, once you declare the strike, I want to call negotiations. No? Then it means they are telling you that we are not ready to negotiate anything. Once it has been signed by the previous government, it should be implemented. If it should be implemented, the issue was resolved far back early December. So how come it was not part of the first quarter budget? Then Uchre will say, Ebia the Kaya signed there, but there are issues with it. It is wrong. Unless if one ye domunina, but nyamani bi wo ho a ado wo shidodo. When you look at some of the videos, na ambulance ba anense ni gyina ho say mufa no commentary. How?
Na mame hwade associations in nine also omo ye adwuma. Professional Association of Psychiatric Nurses. National Association of Registered Midwives. Union of Professional Nurses and Midwives Ghana. Yes. And a Ghana Registered Midwives Association. Not the International Association. Woman Ghana Registered Nurses and Midwives blah blah blah. Mun come in Mumba, Kununya association. Now health ministry or under health, about 5 different associations.
Say research no call anymore. You see some of this development coming up. And that is also okay, say these are not the majority.
Yes. Okay.
And the almost get that majority they are, you see, we can't put them on air.
Okay.
But I must assure you, say, with the current trend of leadership I our ministry, some of these things will have to stop. I am telling you, say, if they are ready for negotiations and if they come with good faith, they will have opened up for negotiation. If you think that the document you have now, problem be anyhow, then come and let's talk about it. But some officer be one this year no, then me cause strike na you can say aban na nyentu. And so we want them at the table. Fair Wages and Salary Commission, Ministry of Finance, Labor Commission, Ministry of Health. And no omono, we want them at the table. Then you translate page by page, line by line, reference to the previous service now we are currently implementing. They duplicated. They was a top up. They was a frame. When you talk about 30-month salary, no, most facilities, workers I want to say that we don't want a 30-month. Because most of the check facilities now almost share maybe some allowances. They give it to their workers.
And they say, Mofa IGF untia.
So, who the IGF and a bit ya. But so who do you call if I say Jack hospital we say we are St. Joseph, Kufuridia. No more allowances are more staffs, which is more than the 30-month. Do you think so they will go for the 30-month? No. So say who do you call baby workers no announce for the years any in support of it. They will vote against that. So you don't just impose things on them say because we are the leaders. We are the leaders, no. Mu declare strike. Omo declare strike na kasa no. Say si amaza maybe say omo wen. And no cry tell say they are not ready. And they know if they think that what they have is fair, if they think that the document they have no competent and genuine, they should go around the table. And I'm saying the government is not saying say we will not listen to you. Government is ready to open and government is ready to absorb some of the reasonable conditions for implementation. But without negotiations, any one share. You the strike no better tie sa, you the better tabai sa. We no mu wia, na we di aba. We no mu wia, na we di aba. We no mu wia, na we di aba. Unstable management. So how would you progress? Oka General only Minister Asia, Namasa General na Minister of Office.
That be.
General na Honorable Minister, not only office. So if you say you came following this since January, you may be lying. Let's be realistic. Oba table, the very first time only Minister Shire, what was the minister's posture? What was his contribution? And the man was working so hard, say he will see to successful implementation of the reasonable intent content in the document. But time be I say, Obias will say Muka Mamumpre. Omo kware we obehwe we afa phone no akogira baby.
Etuomo ba na chese. That is from what
so you are talking to somebody who is not ready to listen to you.
But what are some of the issues we are more pinpoint to say motion ABC in my because a document I think it's 3 or 4 pages.
Yes.
And one they are saying that you are talking about appendix B.
Yes.
It's any some of them are still enjoying
exactly.
Our study.
Yes.
Now B no. I don't know whether you have the
I have it.
Items now. One more can once but then you go through near share near master tibia the air top up. Near my face say ABA. I'm the man by ya moana the adini.
We hear
share
book and research allowance.
Allowance.
No. We share the agreed rate that It said a rate to be agreed by government. And who is qualified? A nursing tutors with PhD and masters. Research in degree awarding public health facilities. Then you must publish some research that is useful to government. We are as a Jusika. And government soon was determine the rate by which you are supposed to be paid. Tibina me buy. Come and let's sit down. Let's determine the rate. Those may cost right.
It all rate to be unsure.
Oh, go look at the document. It's there. Appendix B1.
Yeah.
Then you move to 2 uniforms. That is across board. A bit will hold that. But they are saying that government should top up to 1,000 Ghana per year. That one government had agreed.
Beba. So uniform no. Mama allowance that.
Na ebi wo hoda da.
Ebi wo no.
Ebi wo hoda da.
It's a top up number.
We be a top up. When you go to appendix A, the money nyina bebre wo. Then you go to fuel allowance. 180 liters.
180 liters per month, Anna.
Per month. And it is against 10.99 Ghana cedis per liter.
10.99.
Yes. So calculate this by the number of nurses at Ewoho. Send up a can say
that's about close to 2,000 Ghana cedis.
Yes.
A month. 1,978.2.
Exactly. Times the number of nurses we have. And say, let's negotiate. Because we say no. We are not a teacher for us about.
So why am I there?
Why am we are? Okay. Other thing I will say, we should go to this extent. So when there is an agenda that government is pursuing, now Abansi, let's research. Let's make sure we remobilize the country. Let's make sure we redevelop this state so that we can confidence or minor. Then why would you say you will not come for the negotiations? Then you come to non-basic allowance. If you heard that, they now want 8% to be added.
Okay.
On-call facilitation allowance, 5%. If you heard that, they want a top-up. Uche, rural allowance, rural incentive allowance, number 6. A honor, which facility is in a rural community? So how many of them are going to benefit? Let's discuss. Let me know the facilities that are within the rural catchment. And then we are able to calculate. One share, a honor, I thought there be an ghost names in the banner. The name of announcer at the end of the day will be at least I be banner. Now, the number of rural facilities I work. So let us know. Let us identify. You know, say, any facility, no, a rural community, announcer any rural community. Who was the total number of nurses I was our rural areas, you know. Then you are able to say, okay, now let's implement and answer year to question. But government is saying that, being it as it may, this particular proposal after negotiations, you know, I will implement it for you 2026. And then instead of the 2 years now I work, you know, I will extend the 2 years for you going to 2027.
I see.
So no. So I'm saying that the committee members, leadership, they know very well that they are being pushed by somebody.
Leadership, no?
Leadership, why would you do that? If in their conscience they know that they are on themselves, they should be able to take decisions for themselves. So if you can take decisions for yourself, why don't you make yourself present at the meeting?
Okay.
Committee way. Because I want to you will sit there. No more carry out derby. And now I'm proving you wrong with this document. But you are far away. Then you send a delegation. They said they are coming to consult you. They have to come again. But at the end of the day, we need them. They should go back to work. Government have National Labour Commission have served them with injunction on the strike.
I see. Finally. Okay.
So we hope and believe that they may resign their decision between today and tomorrow. We are pleading with them. Let's take decisions about ball mine. Then yet decisions are about benefiting you as an individual. You never can tell where any of your relatives will be lying tomorrow. Then you will come back and blame yourself. So we are pleading with them. We have our relatives at the rural areas and everywhere. They should go back to work so that we can come back to the negotiation table and look at what is possible best for this nation.
Okay, Divine.
Minia.
Brother.